I'm the new president of the Australasian College of Dermatologists, and it's my job to help guide the college to provide the best possible outcomes for Australian patients with skin, hair and nail disorders. Almost 1 million people live with a lifelong skin condition. These chronic patients need managing and treating over a very long period of time.
I've been seeing my dermatologist, Dr. David Francis, for the last 15 years. Every year I go back to him. I feel totally confident and I have total trust in him. I had what I thought was a cold sore on my bottom lip and it wasn't healing at all, so I went to my GP and she referred me to a dermatologist. And the outcome was I was diagnosed with a squamous cell carcinoma.
A dermatologist is a highly trained specialist doctor who deals with the hair, skin and nails, from eczema to psoriasis to skin cancers to melanoma skin cancer.
The main advantage of accessing my dermatologist, Dr. David Francis, quite quickly was that it gave me peace of mind. Also, it meant that the squamous cell had little opportunity to spread to any other part of my body.
The increased awareness of the fact that dermatologists even exist is incredibly important. There are regional and rural issues that need to be improved as far as access to dermatology and dermatologists. Government support is really important so we can provide equal access to all Australian communities, whether they be in the city, regionally, in the rural communities, the Indigenous community, the migrant community. We need to employ technology, for instance, so such as teledermatology. We need to make sure there's enough dermatologists that are graduated so they can go out to the communities and perform their consultations there, and that needs infrastructure and support for travel, consulting rooms, nursing staff, training new dermatologists partly in the country or in the Indigenous community so they're provided with equal access to the big smoke.
We weren't taught about sun safety when I was growing up. I think we take our skin for granted. I certainly did for many years, and now I'm paying the price. Dr. David Francis has taught me about identifying various lesions on my skin that I need to be careful of.
The projected workforce shortage of dermatologists is really significant. There's going to be a shortage of at least 90 dermatologists by the end of the next decade. It's important that we start training more people now and increasing their access to the community to try and get around this.
We don't hesitate to go and see a cardiologist for our heart or any other sort of specialist for any other part of our body that needs that specialist for treatment. Our skin is our biggest organ, it holds everything together. A dermatologist is a medically trained person who can help us ensure that we have the best health for that organ we possibly can.